Hope everyone is healthy, enjoying the weather. There's an emphasis on wearing a mask. We're not past this. We're not into the second wave. We're just in a continuation of the first wave. That's why the numbers are still not going down. I was in the grocery yesterday and maybe 20% of us had masks on. Remember, the idea is that I wear a mask so I don't spray something on you. You wear a mask so you don't spray something on me. It defeats the purpose if only a handful of people are wearing masks. Okay, anyway, here's the first question. Why can't kids be tested daily or weekly when they go back to school and then separate out those kids that are positive? It's a good question. It's not practical, and I have a video that will help you understand, I think, more so. So this is how you actually
the tip of the nose and introduce the swab into the floor of the nose. Advance
specimen.
the swab along the floor, feeling for obstructions and twirling if obstructions are encountered. Depending on the size of the head.
So can you imagine having 25 kindergartners lined up every morning and saying, "Okay, kids, time for your coronavirus testing." They're going to hold still for that. It's very impractical. So, that's not going to happen. Now, if the test were more oral, where you just go in with a little swab and swab the inside of their mouth, then that would work. But right now, the way that the specimens are obtained, it's very impractical to be testing kids. Even as an adult, I don't want people doing that to me every single day or every week. So next question. Or next slide. So this is similar to a slide that a mom had sent me, and this was in late March. And she said, "Do you think this is COVID-19? And I said to her, "I don't think so, because there's no relation between skin changes and COVID-19 presentation, especially in kids." Well, as it turns out, I was wrong, because as more and more cases cropped up, especially with kids, this is considered like a COVID foot. Some people get COVID toes. There are these changes in the blood vessels of children. They're more affected by the inflammation on the inside of their blood vessels. They get a discoloration or a bruising, and sometimes the kids are presenting like this. So this actually is a presentation of COVID-19 in a child. It can be in an adult as well, but this was, like I said, similar to the picture that a mom had sent in to me. Now this was another picture that mom had sent in like a few weeks later and said, "What do you think this is?" She said it's it's not itchy. And I thought, well, maybe it's just like a dermatitis. Child's an athlete. Generally, athlete's foot, a fungus is between the toes, not on the top, but it could be athlete's foot. Anyway, as it turned out, this is not COVID-19. This was an athlete's foot that responded to an antifungal cream. Next question, is this COVID-19? Mom sent in this picture of her son's throat with this white stuff, the exudate. And, I can't say anymore this is not COVID-19, because as more and more cases happen, you're finding more of an array of a presentation. But as a general rule, this is probably not a COVID-19 presentation. It's probably more related to a strep or a virus, Coxsackie, diphtheria. Probably not COVID-19. The only way to know is to really take a specimen of this and send it to determine what it is. This next picture mom had sent in of this child with kind of these flares on her arm that were itchy and a little bit red. This is probably not a COVID-19 rash. This is probably an irritation or a dermatitis or a contact dermatitis, rubbing up against something, maybe an insect bite. So this presentation is probably, like I said, contact dermatitis that would respond to probably a steroid cream, over-the-counter steroid cream. And I'll do one more. This is unrelated to COVID-19 because I thought I'd break it up. But again, with the telemedicine, we were taking a lot of pictures in without physically seeing the kids. And this dad had said his son got his finger stuck in some bricks that had fallen. And the question was, will his nail grow back? It's a gruesome picture. His nail probably will grow back. What I had spoken to the dad about was he probably would need an x-ray at the end or the distal tip of his finger to make sure he doesn't have a fracture of that bone. I think that's what I would be concerned with. So that's it in a nutshell. I'm not going to go into too many more slides because I want to drag you down with all this stuff. But you're welcome to keep the pictures coming. I'll try and share them with everyone. So hopefully spread the knowledge. Please wear your mask. And thank you very much. Hope you have a great weekend.